All right. Mimamuna Akwaba. This is a special edition on my story. We yatune din say healthy nugget. Ya take a quick break akra. You bet to my story. But this is a new series. Ya shall see last week. Mobekaya, Dr. Robert Okyere Ebai Ebemaye an overview about Yakuma Hon Insensem. And the second lesson eba na ne deɛ no ampaya ebedwa yɛba abɛhwɛ heart failure yɛka sɛ wɔnya akomayareɛ anaasɛ wɔtwa ahwe heart failure no sɛ na esitie ɛnɛ doc ɛde yɛ ɛba abɛhwɛm na yɛahu yɛwɔ some misconceptions bi ebi mu wɔ fa akomayareɛ ho ɛne deɛ kekakeka ho nti doc mɛfa saa akonnwa no mama wakɔ aba na ho te sɛ
Yeah, Adjei, Pastor, nyame adom ɛhɔ yɛ pakyɛ so ho te sɛn.
Nyankopɔn adaroma me nso me ho ɛyɛ yie paa ansa na yɛbɛkɔ yɛn anim dɔɔko bɛbɔ mpaeɛ ama yɛn.
Okay, pakyɛ yɛmmɔ mpaeɛ. Yɛn Agya a wɔsoro da so sɛ wabɔ yɛn ho ban wahwɛ so throughout the whole week. Wasa ma yɛ privilege sɛ yɛnsan bɛhyia na yɛn discuss yɛ health. Yɛhwɛ sɛ wobɛboa yɛn na deɛ yɛbɛte, yɛbɛshare with others na ɛbɛtumi aboa improve yɛ health sɛdeɛ ɛbɛyɛ yɛbɛtumi asom yie. Yɛhwɛ sɛ wobɛka yɛn nyinaa yɛ ho na wɔahyira yɛn wɔ Yesu din mu. Amen.
Amen. Yɛda doc yɛda wase. Sɛdeɛ yɛa na yɛdi kan ɛka no dwumadie sɛ wowɔ ho nsɛmbisa bi if you have any question now feel free to put your question in the comment section hɔ na ɛba the following week doc ɛde ɛho mmuayɛ ɛbɛba. As I said earlier on, today our topic is heart failure. Akoma as yɛsɛ akoma yareɛ our na ebia for you to see how important this lesson is, doc me mu kakra about this particular yari you say heart failure nipa almost say annually amphibia US ha omunya bi no 96,000 nine not nine no mama can ye 960,000 people annually ewo US in a heart failure additional doc be my na almost say we nipa and what tribia ewo US emu baako enam saa yare ways ntino ya so deti na menim say ebeye nhia na afi won so bebo won ho ba nti doc mejai ama na afi wama ye wi a mebem na afi questions nso no na afi ye questions nso nyina ano nti doc over to you.
All right. Thank you so much, Pastor. All right. I'll go ahead and share my screen. Okay. Now, patch now, my screen though.
Yes.
Okay. All right. That's a Pambian Pastor, and welcome everybody again. You don't want to send Matiki time. What do you program way? Again, I am Pipe was say bit my boy. I improve your promoting. Now the audience so I think say be very good. Say you to me share with others. The way you know bit my boy your home. Not through improvement in our health. You bit my sum your coupon ye. And that topic no a general overview of heart failure. Na yɛkasa heart failure exactly divided na yɛkasa about. This is kind of the outline of nneɛma a yɛbɛkasa about. Yɛbɛ talking about the definition of heart failure and yɛbɛhwɛ different types of heart failure ɛwɔ hɔnom. Ɛne ɛkwan a heart failure is presenting ɛho. Yɛbɛsa ahwɛ sɛnea yɛsi evaluate heart failures. Yɛkasa bi ne bi ɛkwan a yɛfa so ehu so nipa korɔ no wɔnyɛ bi. Ɛna ɛkwan nso so a yɛfa so yɛsi manage heart failure. Now, before say you getting into too much detail, though, I think it'll be a very quick overview of Equine Akumano ACT and how the heart looks anatomically. In Sierra Akumana, it will 4 different chambers, as we can see on this kind of this image on the right. Into the top chamber of the heart, your friend atrium, and a bottom part of the heart, your friend ventricle. So, in addition, say you have 4 chambers of the heart, yes, I will kind of the right side of the heart. As you can see here, and what the left side of the heart. Now, quickly kind of going through how heart is here, Jumano. Into moja, I go through the body, the oxygen, I'm a body now. Some moja now, I return it back to the heart, back to the right side. Into it started from the top part now. Top part in front of atrium. Into started from the right atrium. Now called right ventricle. No? If your right ventricle now, suddenly you see who picture now on our left hand side though. From the left ventricle, it travels through a vessel. So that vessel in front of pulmonary artery. Now call lungs. I call lungs now call oxygen. And oxygen area now start travel through another vessel, your friend of pulmonary veins. Now by the left side of the heart. And again, it comes to the top part first, about the left atrium. And so now about left ventricle. No. If your left ventricle now I pump blood no into a blood vessel, your friend, or aorta. Through this aorta, no, not blood, not called the rest of the body, called to brains everywhere. Near the new, fresh, oxygenated kind of blood distributed to the whole body. Now, since you hear kind of a picture we see as well, yes, our different kind of, I like to say, gates, your friend of valves. Say blood no it move from the top part to the bottom part na gateway no I friend of valve no it be na ma moja no every top no about bottom. Say could you bottom honum we before say blood no be free sa right ventricle no and that's at this chamber according to sa pulmonary vessels no sa valves no that's a gate no it closey so the by blood no and sank back to the top into your first kind of when you valve there's also another valve in the pulmonary vessel. You saw another valve on the left side, and I saw another valve inside the blood nose. Once the blood goes into the aorta and the rest of the body now, it was a valve closely. So the body need samba back and cause problems. In T, kind of way, kind of a quick overview. Now, you can say heart failure, right? You refer to say a commano a pump, right? Into before see beat me a move blood no from the right side to this pulmonary vessels. I'm gonna me I call lungs, I call your blood no. It was a heart no, is squeezing a pump of blood no, right? And before say a command so it beats me I call into say aorta and I call the rest of the body now. There was a side left ventricle no, and also pumping into the main pump of the heart no, a left ventricle. And I heard left ventricle because they pump it to the rest of the body through the aorta now. If they see a lot of kind of pressure into left ventricle, no, usually any the main pump of the heart. You can have heart failure with say pump from the left ventricle, say any jumaye. And I say right ventricle, say so any jumaye into me pump blood well, and man into me call lungs and call blood. But usually when we talk about heart failure, we're usually referring to say left ventricle, and that's a left chamber now, a pump blood or oxygen to the rest of the body. And then you can say kind of heart failure. That's a kind of what we mean by that. Now, kind of to get more into the definition of it, heart failure against with the picture that we just looked at. And say akomano progressively are you weak into me and pump oxygen rich blood to sa aorta no I beko o brain and I say o stomach on sa on nine ama sa o body parts no enya good oxygen. Now, aside from say heart failure due to sa pump no not working well. Another form of heart failure is say akomano intimate relaxie, a friend of stiffness, it becomes a bit stiff. And so those are usually the two main types of heart failure. There's another kind of class, and maybe another time Rebecca about, but in terms of kind of contrasting these two, these are the two main forms of heart failure that we tend to see. Now, usually, say akomano, right? You go back to this image, say pump way left ventricle into me and pump blood enough to the aorta to me right? And that's a weaker. Moja ni bibiti masako back to the left atrium, right? And from the left atrium, remember say moja no if free some blood vessel we are if free lungs in the body. Into say into me pump na kumani weaker. Fluid bitima come back into the lungs. Now cause accumulation of extra fluid, right? And I seen a person is in the introduction no. Heart failure is very prevalent, a common disease affecting the public brain, both Caucasian and blacks. Now, here, US nearly 6.7 million adults over the age of 20 years have been diagnosed with heart failure. Now, it's associated, it causes a lot of symptoms to amount for, and it's leading to kind of untimely death, right? Say time, I should say, say it was a heart failure. So, unya bina yen treating year bit me before time shama. And I seen a pastor and sister during the introduction now. Heart failure accounted for about 8.5% of all heart deaths, right? Into a hair or more move from heart disease, cardiovascular based disease. 8.5% of it's now due to heart failure. Now, just to kind of give you an example of what we mean by heart failure now. One of the modalities you use to assess for heart failure now a ultrasound of the heart, and I see a friend of echocardiogram. It is you see a kind, based on the first picture of the chair. So first picture, you can say top part of the heart, your friend of atrium, and the bottom part, your friend of ventricle. On the echocardiogram, it is same thing, but kind of you're flipping into top parts, a ventricle, and a atrium. And I said, what kind of ventricles, no, and then the main pump, specifically the left ventricle. Into your picture where we know in a left ventricle, and we need a left atrium. Again, left ventricle is the main pump of the heart, and a right ventricle is also an additional pump. I pump blood into the lungs for through the pulmonary vessels, so they be able to maintain oxygen. Now, your heads are these two different types of ultrasound. It means say ultrasound way akumano in squeezy very robustly. It means say akumani weak, right? Into that type of heart failure canal say bit my due to say akumano a weak into me squeezy ye. And now your hands as well on the left side now, you can see akumano it's squeezing very nicely, right? In terms of squeeze no normal, but what say kasa about say akumano I stiffer. This is how it usually tends to kind of present. The way I see kind of diagnosis akumano I stiff, and I say into me relaxing, and I some additional kind of measurements on sa echocardiogram, and that's an ultrasound of the heart now. And on the boy I might distinguish between say akumano I stiff and I say normal. But these are kind of the two different types of presentation. Either said the left ventricle, and I said the main pump of the heart is weak, and I said the pump is fine, but it's not able to relax well, right? And these are kind of two examples. Other modalities in so I said to me use to a boy made me assess for heart failure, and I said to kind of looking to neoma a cause heart failure no a cardiac MRI. Into we see two different types of examples of a cardiac MRI of two different patients. Again, see her right side now. It means say pump weight. Just to give an orientation, this is the left ventricle. You can about the main pump of the heart, and our right ventricle. Or here to say kind of pump weight very weak. It's not really squeezing that well. Say it's squeezing very, very, very weakly, right? Into way say unipercoronal or heart failure because pumping function of the heart is not a weak. And I heard how as well to pumping function a fine. It squeezes very nicely into a hand kind of pumping function a fine. But again, unipercoronal is still between your heart failure because the heart is not able to relax well. I still. And again, if also say it distinguishes between say unipercoronal or heart failure because akumana is say be additional test. Na ye aboy meeting say be a stiffness, and I say akumano intimate relaxing, and then I cause heart failure. And I say indeed akumano a pumping normally. Indeed, this is kind of also to kind of give another example in terms of the different modalities. Your fossil and the say akumano a pumping a strong and I say a weaker. Now, kind of going further now, as we just talked about, the akumano a pumping weak, means squeezy. The term are different on a heart failure with reduced ejection fraction. You can say ejection fraction. The trying say with every heartbeat, say akumano every time now, the heart it's supposed to be able to squeeze at least 55% of the blood, right? Into akumane pompibia moja a whole body it was say team squeezy at least 55% of the blood a whole oxygen back to the rest of the body. So the kind of the body can get the necessary nutrients and the oxygen that it needs. Into ejection fraction say a less than 40%, and I say with every heartbeat so command intimate squeezy 55% or higher. I am normal Now is squeezy less than 40%. Your friend is say a heart failure with reduced ejection fraction, meaning sa pump a weak. Now, it may causes heart failure with reduced ejection fraction, and that's a weak heart function. When your heart attack, and that's a coronary artery disease. You can say about this very briefly last week. And I say valvular disease. You can valvular disease. The na you can about in terms of the gate. Say blood if we top echo bottom. Gate it will say be say echo bottom na it will say close. It be more honoma gate and I say valve it be into being close into blood circle back to the top instead of going forward. And it be so honoma side gate a stiff into mean be into also to me cause a heart failure. And the other thing, kind of in terms of causes, say, I dilated and that's how big. An example, kind of a video we are here, ultimately say, kind of left ventricle, a really, really big and dilated. Now, in terms of dilation, you might me causing my aquania dilated alcohol and that's certain infections. If it's my cause a kind of dilation or I'm gonna lead you to kind of a weak heart function. And that neoma bit my causing so your friend infiltrative disease, and I say kind of substances, and I say proteins, a deposit, and I say a could go accommodating. It would be to me, my very, very thick. Na yes, accommodating to me, and pumping into me, in squeezy. And in some cases, so a bit more on my normally genetically predisposed. So in terms of more family history, no, a bit more on my running the family say, almost heart failure at a very young age. There are kind of several patients you are young, either in their 20s or 30s, some heart function are really weak because of kind of their genetic predisposition to that. But the most important thing, right, in terms of say heart failure, is, whether it's kind of because pump no any juma year. ASL, you be find it out at the correct cause, right? Into a heart attack, say you address a heart attack, no, na say be only a stent, you be more stent, and that's only a surgery, I'll be a surgery. And I say ABA, say a infiltrative disease, so substances na it could go up on a mark thick no. So to me, who are the correct cause, not to me treat at the correct cause, and no boy, am command functional, it to me get it better. In addition to kind of say a treaty at the cry, a cause my heart function I weak no. Yes, I will know it me use your boama functional, it me get it better. And in terms of the second type of heart failure, I kasa about no. It's again the first type, is a pump no I weak. Heart failure with reduced ejection fraction. Again, ejection fraction is how much blood commando it me squeezing with every heartbeat. Into normal, a 55% or above. With every heartbeat, Akumane will see to me squeezing at least 55% of the blood. A squeezing less than 40%, Akumane is weak. Your friend or heart failure with reduced ejection fraction. And I say, Akumane to me squeezing okay, it's a pump function or a okay. Now it me squeezing more than 50%, right? Your friend or heart failure with preserved ejection fraction, meaning say pump no a juma, may be before for and it causes a heart failure, no. Now, the chronic causes our heart failure. And since you kasa about earlier on, no, because akumana is stiff, and as akumano intimi and relaxing. Now, new man, it's me lead to say akumano is stiff, and as intimi relaxing, usually as we age, you know, akumano if you on it's me gets a little bit stiff. And I say obesity, say weight, it will really high, and it may lead to stiffness. And I say inadequate relaxation of Komano. And I say high blood pressure, heart attack, and I say coronary artery disease. And also it may contribute to stiffness of the heart. Additionally, say what diabetes and also what kidney disease and I say arrhythmias. And no, you better find the time I can say about it later on, but because arrhythmias, I say Akumano ebo kind of irregular. Right. An example, a common for some people, atrial fibrillation. Into Sakumano, into me, electrical system na any juma and also to me, Kwasema Akumano a little bit stiff. Na a sign to me relaxing, and also to me leading to heart failure now. Again, the most important thing with heart failure with preserved ejection fraction, so you say you ever find the underlying risk factors, right? Into say obesity, losing weight, and then kind of following a healthy diet is important. Diabetes, it's the same thing, right? Healthy eating diet, as well as a key a dry prescribed amount. And I say coronary artery disease and I say heart attack, addressing that that can help improve a common function. In addition to inura, ibitimi as a prescribable, I'm going to ama akoma no function or it may get better. Now, again, in terms of risk factors, now we've talked about some of them, but just to kind of re-emphasize again, age, you know, and what to me kind of a predispose, and I say it's me my yes susceptible say being heart failure, mainly with sa command yes stiff, and I seem to me relax the again, so high blood pressure, and that's when your heart attack. And I say if you more honoma, your warm no more your friend of congenital defects. And I say obesity, any family history in terms of genetics, no. Ni na to me contributing to heart failure. And I say it's me predisposing and my individual say at risk for getting heart failure. Now, in terms of symptoms, the quite been you first see a diagnosis heart failure. And also being heart failure, symptoms been a what time in ya. You heard the usual symptoms include shortness of breath, and that's only per chrono when to me humidity and that's an humidity. Be more so or more feeling very fatigued, and I say I am almost feel so my brain. Either say so or more exertion or more and or more nanti, and I see be more honor crow, more te honor no 1 year here, no more or more feeling so my brain, and that's all more humidity. And it be more so honor my coughing, and that's all more wheezy. Reason being says the blood no intimate pompey, intimate body na, it may come back into the lungs. A call back into the lungs, I mean fluid in the lungs. Because of that, now I know more boa, and I say to me more it's me cause reason. And another kind of typical symptom, and that's a sign, and say it be a first no here just one pillow to sleep on at night, but kind of over time no, you find say we here bear 3 and that's 4 pillows because okay so that flatter now or home and also feeling short of breath. In the beam so on so more than and you and I say middle of the night no but sorry because I'm feeling very short of breath and I say home ni na is sign say be a one per heart failure. In terms of kind of physical symptoms, it's just to say you'll be heart failure. It usually say leg swelling, that's a lower extremity swelling. Obi on man na say atatai into you know a kind of it's me a feature of heart failure. But and you be an a swelling necessarily. It be more honoma or more accumulative fluid, and I say kind of say a commanding to mean pumpy fluid no a more abdomen into be a maybe in the belly, no, not get it bigger than usual because the honor all accumulate fluid, no, into either the legs or the belly or both. Say kind of it gets it bigger than usual. And that's what's our kind of shortness of breath, no, not all coffee. Nina to me, signs and symptoms, CBA, one per or heart failure, and a weight gain, right? Say aside from CBA, so here we did you now you exercise, not still gaining weight, not how all of these other kind of symptoms that may suggest beyond coronal or heart failure because we'll keep extra fluid, right? And to keep extra fluid and all, naturally that would also cause your weight to go up. Now, in terms of classifying heart failure, you're different kind of classes, right? And then based on class on per coronal one, you depending on kind of management, the massa one per coronal. Will be on my ABO to me exertion or to me exercising and some of that are really short of breath. Will be so on your hands so that no home ni na check how severe and that's the severity of heart failure no on per chrono elbow. Into these are kind of some of the tools you use to integrate this heart failure now. Now in terms of evaluation, acquire first is diagnosing heart failure now. The main thing you say heart failure for a clinical diagnosis it's based on symptoms, right? And a physical exam I be it's usually a whole clinic and as a hospital you look at your hair or your vein be on honor say a lot of fluid on board and I say kind of acutely in heart failure it's me boy me who say beyond per corner or extra fluid. And again, because a heart failure, no amount for tie it mean accumulative fluid in their lungs. Say it's your lungs necessarily do on my it makes some sounds be a transfer per corner or extra fluid. And I say her on 9 me on 9 say be a swelling or on man I say we yema me boy mate me making that diagnosis. Other tools and so it me using say EKG and no boy mate me ascertain to see there's a component of maybe a heart attack and maybe a contributed to sound on your heart failure. Additionally, imaging you use a buoyant no ASI echocardiogram and access our ultrasound of the heart now you heard earlier on no and that's a cardiac MRI, especially say ABI per se figure out how the correct cause of heart failure now. So MRI needs to be a boa and a chest X-ray and so another imaging modality to me one may kind of in terms of maybe how much fluid I want to per say how much in on per chrono the lungs. Into when you different kind of modalities, it's me boy made me diagnose heart failure no. But again, the key thing kind of signs and the symptoms, right? And they say you who hospital as a clinic you evaluate you. So when your fossil, it's me boy made me make a diagnosis no. Now, this is just to kind of give an example of what a chest X-ray kind of looks like, right? So on the left side now, on per lungs now, into when you lung, when you the left lung, when you the right lung, right? And our command in our hand, not most lungs now are very clear. And our picture, yeah, it will right here. To say kind of all of these fluffiness, who are lungs now. When you know extra fluid, it was on the per lungs more. Chest one per or heart failure will be here help with getting some fluid now out of the lungs. Now, in terms of say getting fluids out of the lungs, no, so only per or heart failure, you best start by say you can about heart failure with reduced ejection fraction. No, acronym I tied them one on your friend of HFrEF. Saying is your trying to no heart failure with reduced ejection fraction. Again, meaning say akumano pump function or a weak, right? That with every heartbeat, akumano ABTBI it is squeezing less than 40% of the blood out of the heart. And again, that is the definition of heart failure with reduced ejection fraction. Now, in terms of INRA, you use to help manage and to try to help improve the heart function. One of the classes, we tend to use 5 different classes of medicines for weak hearts now. Into the first class now a diuretic, and I say your friend of kind of water pill, right? To say example now hear CCR with the chest X-ray, only percordial fluid in their lungs now. The way to get fluid out of the lungs is by kind of taking a water pill into an acid diuretic. So a journal take care mouth Johnson be brave. So the by extra fluid the whole body in a bit me free honor. Now side diuretics, for example, yeah, furosemide and acid Lasix, torsemide, and acid Bumex. These are the types of kind of diuretics and also water medicines are prescribable to get rid of fluid in the body or in the lungs. Again, it's also really important for more and more hearts now, or more heart failure, pump no eye weak now. It's very important to control the blood pressure, right? So akumana eye weak on per se besa blood pressure na besa was sure na akose akumana se be work extra hard just to get blood out, right? Since a very important say. If my blood pressure no I low and nice, said by akumano enya extra stress, right? Na sa blood pressure a dry tie useful for more heart function or a week no. A bine entresto and also like Sinopril and also losartan. In addition to that, no, we also control the heart rate, right? Heart rate near kind of how quickly the heart is beating. Against all heart failure, not heart pump no, are you weaker? 1% pump no a bit beat fast. Right? ASI, again, extra stress and extra work for the heart. Now, the way I see bring the heart rate down, so the way I command and work extra hard now, you say in Norway, you're from the class, you're from beta blockers. Into example, your metoprolol, carvedilol, or bisoprolol. And again, another class of medicine, you use to, in Norway, usually say a command function, I reduce, now you weaker, right? Over time, no. Akumano, it's me making changes. I do on my it's me and my scar a form. It's a scar form, usually a irreversible. And I say untimi sano. To prevent scar from forming in the heart. And I say kind of extra tissue, from forming in the heart now. You used to say in your way, your friend I that's for lactone, and I say a plurinon. So in your way prevents scar. From forming, not a bois with kind of remodeling, acquiring heart now, ABC, etimi kind of etimi, a worky, any irreversible damage. Into sign Norway, spironolactone, and I say no, and I use. And then the last class of medications are useful to help with more heart failure with reduced ejection fraction, and I saw more pump now, I weak now. If class in front of SGLT2 inhibitors. Into example, is Adjei, empagliflozin, and I said Jardians, and I said dapagliflozin. So neuro technically a diabetes in neuro, but SI in neuro are very effective for heart failure. It's me a reducing mortality, and I say a reducing kind of early death, And I say be a nipa no hospital again and again because we're accumulating and also will keep extra fluid in their lungs no. So a draw way to me a prevent a minimizing pakrono ibi call hospital repetitively. And again, the key thing is so you better find any treated underlying risk factor, right? Into say ABL or extra substance no or heart name and I say ABL or heart attack, finding the main thing I'm heart no are you weak in the first place no. And only the key thing. Now, once we're able to address that no, in addition, these kind of 5 classes of medications too are kind of very instrumental in helping say akumano the functional, it might get it better. Now I get it stronger being. Now, in terms of the other type of heart failure, no, the kind of say heart failure with preserved ejection fraction, and our acronym I demand a HFpEF. And again, so heart failure we a due to say no intimate relaxing and as I step, right? In this case, no pump function no air fine, pumping no air normal, but no intimate relaxing. And also so kind of you use 3 main classes of medication. Again, the diuretics and also water pill no. It's me keep fluid off no. It's me prescribe it that as needed. CBA will be all extra fluid in their lungs and I say or more fluid there in legs and I say in belly. It's me prescribe water pills we and my ultimate a Johnson science if you honor. And a blood pressure again on pesakumano ever work extra hard. Sakumana is stiff need to be relaxing. The last thing I open ASA obama akumano obama extra stress into controlling the blood pressure is also very important. We usually use blood pressure medications. And again, in terms of say yeah, preventing fibrosis, scar tissue, extra tissue na say we see a intimate and gets back to normal no. So in runa prevents scar from forming no, spiralactin and say pleurinol no, and also use for this type of heart failure. And again, the last kind of class no is SGLT2 inhibitors, diabetes in neuroya, it may prevent frequent hospitalization and that's so we go hospital frequently. Now, it's me a reduces say bewu and I say on bewu earlier than time and your shama as only per chrono. And again, the key risk kind of the key thing in terms of management, right? And say you be treated underlying cause. In renal, a good. In renal, very helpful. It may no functional, it gets better. But the key and the most important thing you say are the prior causes are heart failure, no. And again, if I say or more heart failure with preserved ejection fraction, that's a HFpEF. And I say or more no eye stiff no. The high cause here obesity and that's a high blood pressure, diabetes, no. Inti se ultimately lose weight na say diabetes no it gets under control. Ni na to me in terms of managing and treating this type of heart failure. Now, just to quickly kind of touch on other modalities you use now. A bit more heart failure now, yeah, really advanced, right? Command I weak to the extent say into me any extra support. Now, in those cases, on one way really kind of a more really advanced heart failure, you know, you were kind of an algorithm and a pretty extensive evaluation or go through before somebody might qualify for some of these extra management modalities. Now, some of the tools I use to manage your more heart failure, you know, you're really advanced. And I say I call Adjei, you know. ABB, a friend or left ventricular assist device, and I say LVAD. It's basically a pump, your kind of open heart, you be or chest no. Now you decide device no, they are inserting into LV, and as a left ventricle, and I can say about earlier no, which is the main pump of the heart. I squeeze the blood no to the rest of the body no. Into basically they place this this device into left ventricle no. Say the left ventricle because I is so weak no. I mean squeeze, you know. Some machine, you know, kind of does the job of some pump of the heart, you know. Into moja no a bypass left ventricle and now go through some machine, you know, and some come back into some aorta, no, and I say the main vessel, the blood, the rest of the body, you know. Into more makuma you really weak, you know. It be more honoma, what me qualify for some LVAD way. Into again a surgical procedure, more basically acting like akuma to me improve some patients no more quality of life. Another modality is also a heart transplant, right? So you weak to the extent say patients no about hospital repetitive and also or tie core hospital because untimi humi and I say the daily living no I significantly impacted when per it me put it me the transplant list so and new heart. And another kind of type of device I use, I had to say pacemaker, right? Into the leads, but call the right side of the heart. And another one, they call vein, bimoa, and also a buama, kind of the right side and the left side of the heart. No, a bua, emma, nimino, it's me squeezy. But also see different kind of criteria you use to determine so some patients or qualify for some device and I said pacemaker. The technical term for it in front of each cardiac device. Into and also another modality depending on the type of patient you're dealing with also so it may use improve heart function. No? Into overall we kind of a very quick broad overview of heart failure. Again, you can say about say heart failure bit due to say akumano pump no are you weak. Your friend of heart failure with reduced ejection fraction. And as akumano I stiff intimate relaxie and your friend of heart failure with preserved ejection fraction. And again, you heard different risk factors, right? Between heart attack, obesity, diabetes. And again, getting all those risk factors under control can help. And it's actually different neuro, it may use and also to me the heart function, it may improve. And again, we spoke about kind of the different symptoms, right? And signs are a bit more suggest to say will be a heart failure. In TBA, who san you may say all questions about a very good say doctor, right? So be with my additional investigation and evaluation to make sure say only any of those types of heart failure. There are other types of heart failure man kasa about. ABN next time you bet me akasa about. But just very quickly, another type you see will be in kind of a big stress, right? You can see will be unexpectedly. And I say be Okyere Adjei when I say ukune ja obi wo hono ma yaw no and I say be one per kono ni mo ehye no it mean ma koma no functional it mean and so echo form one per kono it mean heart failure. But that is just kind of by the way there are many different kind of classes of heart failure. But in general, this is kind of the approach you use to manage the diagnosis of heart failure. I hope say this was informative. And again, I'm in say you be share with each other. Now you be stay kind of on top of our health. So that be your quality of life no it be good. Yeah, to me, I kind of proper service to both ourselves and also to those around us. And I'm so so bit my boy mate masu nyami. If you some more any questions, please feel free to either put in the comment section and I saw email address me and so to maybe I'm person will writing in the comment section. You can also send an email to us. So any questions I will be happy to discuss the next time we meet again. Until damase. So when you're
all right. Doc, Yaminsha, and one my overview. What the alpha near my heart failure ever no cry no what can you be now a few questions be a doc boy. My first question is kasa akumayare at what point na ebi obi a ya diagnosis or akumayare symptoms na edru baby e was a rush no dey call hospital e dey na ono a wo fear as a banimu at wedi e say me rush at as me friend 911 and I say you dey hospital right away and no signs and symptoms e bi ne dey here.
Yeah, a very good question. I think say kind of the earlier or realize symptoms are one on. So what me contaminate me addressing it better than say over trying to say be late. Because if you more honor more me ba hospital honor na or more heart failure no a really advanced stage. And your friend of shock and I say cardiogenic shock. Kumano again see normal it will see to me squeezy more than 55%. Obi wɔ hɔ no maybe heart function or maybe 10% and that's a 5%. Into those individuals, so usually you additional devices ɛbɛboa akoma no ɛbɛnatumi aworking. But generally speaking, say be a home and also want to take a first no, wotumi call grocery store, wotumi call Walmart, and I take a to be a but I say Opia cart no could drew meat section as a vegetable section honoma now we feel very short of breath on homete. And that's what you honoma home ultimately say easy. And that's all bow from nowhere. And that's all nine oh honoma now I started air tai. And that's all belly. Udidi about belly no I started get big. Ni na kind of signs and symptoms see beyond BB coso. That's how the corona it will say address it. And I say be most honoma again in terms of your causes heart failure no. Obi on obetumi heart attack, but na silent. Once you any symptoms. Into say be who san your way I think say a good sober cornea evaluate on term na so be trying to later over corner over na ibiana oda won't pass as one. The earlier you realize it, kind of the better it is to kind of and the better it is to go in early to get evaluated.
All right, Doc, me that's it. Now, the be a message we can say, let's assume say nipa you diagnosing or heart problem. So diagnosing what they do. So, is at what point maybe or no one will feel na say or no one into heart failure no the condition I emergency so or friend 911 and now say or no one call hospital right away. I don't know so emergency signs in the
Yeah, again, a very good question. I think so. Yeah, very, very good question. In terms of the different classes of medicines I use, kasa about especially with the water pills, diuretics, or heart failure, yeah, prescribed no. The purpose of adrenaline, especially with the diuretic, and that's how water pill you say, Johnson, right? Fluid no every body name, and that's our system name. Maybe still no gain even more weight, right? None of whom add to more. In those instances, no, a really important say but when I still at high and get better. Belly no still get bigger. But still weight no cause one cost and I say but still home no edasote. Me na science also call EBA journal was see a changing no. Right? And I usually say, be acutely in heart failure. I say adrenaline through the IV, right? The way I kind of body is absorbing adrenaline, a different one given in an IV form compared to one given as a tablet, right? And if you want to also corner your bow, it gives us IV adrenaline, ultimate journal. So we are near adjusted adrenaline dose, and how frequently also taken out. When you know kind of you might be use a bit more boy, I'm going to optimize your health.
Okay, another one. Yes, say on left, yada umutaka say man so on left you hono yo we ya no say we nya heart attack. And no, a left and now right now no sa chitrimuno. A mad na left na me chitrimu ya hadi hono.
Yeah, I don't think so. And you're necessarily in my inclined to wish, this question again, this is a good question, but this pertains more to coronary artery disease and I say heart attack. And the way a heart attack is presented in terms of symptoms, no, a very variable. And I say a different for nipa bebree. Inti enye manko ebi mo honoma o mo feel pressure o makoma no. The way a nipa bebree describing it is say I say osono and I say elephant etna koma ne chest so. A lot of pressure. And as I pressure no, if you're not koma na a radiate a corner left no. And on a month for a tie it describes say pressure from the chest that goes to the left hand. But aside from that, no, usually, especially for symptoms, no, or more usually a friend of epigastric, and that's a uyem hanum no, or upper abdominal, on pain, and that's what we want cry acid reflux, right? And that's a GERD. And again, the sign say EBL when your heart attack. But usually, chest pressure that reduces to the left arm, and I say especially in a epigastric, and I say stomach pain. Into the way a heart attack is presented a very variable. Into notice be a concerning to you, it's always good to kind of get it checked out because from that standpoint now, because the time is myocardium, right? Yes. So when your heart attack now try that portion of the heart na blood into me that portion a bit me and also lead to heart failure, right? Into me now connected.
I see.
And also.
Last week, there was a time, one about activities and nipa no betimi aye. So obi ewo akomayare obetimi abobo obi kura no obi say wa warrior obetimi ne yere ehiem o akoma problem ya na osafo no de omuntimi nyesa ne man ehɔ no onim chichimu ade be my quickly.
Yeah, kind of a normal activity. So it depended kind of in terms of akomayare, which type you're talking about. Say ABA, heart failure, Yeah, absolutely. See, get fluid no off we are. Bit my course why idea. What's all we be in terms of exercise. Exercise is always good. And I
Mm.
think about last week, exercise is and so it me boy it reduce your blood pressure. Aside from that, see be you can say a heart attack, when you have fresh heart attack, maybe the initial week or two, no, you better say you're too aggressive. But over time, no, you encourage you to get back to whatever you were doing. See be now or I know on the treadmill and I say utu Americana so bike, yeah, encourage you. Depending on what kind of akumayari, there are some akumayari and exercise that you're a little bit more careful and maybe a little bit about. But in terms of heart failure and a heart attack, once you address this issue, it's always good to exercise kind of at to the level where you're comfortable. And also and too many issues.
All right. Doc,
Right.
nyame inshallah, nyame
But
eya
that's a
adoma
pastor.
yesa eba beto so this is healthy nugget. Sarbi ye ma ye doctors for akukuda eba no be ma ye disua kwan amenu mienu ye betimi afa so atena se ye ne doc am ya hwe heart failure akoma entimi mo adwuma yi ene ne
Right.
ma ye betimi aye. Oh, question bi afa to comment section ho. Nyame adoma next week. Doc Ed Beba na afei watumi abɛbiebie mu nyinaa ama yɛ nti ansa na yɛbɛfiri akora no mu ma yɛmmɔ mpaeɛ yɛgya wɔ soro yɛda wɔ ase nsɛm a wɔde ama yɛ boa yɛ na yɛankɔduru saa mpɛmpɛnsoɔ no mpo obi a wɔtie mi a ɔwɔ akoma problem bia no yesu di mi ɛsɛ sɛ sa no yareɛ nneɛma a ɛsɛ wɔn
Amen.
no tumi yɛ no boa no ɔno nso ntumi yɛ hyira yɛtiefoɔ na hyira Doc nso ma yɛ wɔ yesu kristo din mu nti amen.
Amen.
All right. And nyame enka ho. Nyame adom a ebeshia. Bye bye.
Bye bye. Thank you.
Okay.